Hi, and welcome back to the channel. On this channel, we talk everything books, nursing, medicine, and university related. Today, we're going to talk about a nursing topic. Actually, I did a topic on Lucy Letby about her being in court for murder. She's a child nurse or pediatric nurse, and several children turned up dead. So I did a topic on her. And one of my students actually sent me this article. And I thought, I'd read this article because it's quite interesting. And for those who are not nurses or, anything to do with medicine, this happens quite often. And this very scenario, I know a nurse who has gone through this and who's done this. So this happens quite often. So I'm just going to read it. For all those who think that I'm clickbaited, by the way, this is taken from Nursing in Practice, and it's a nursing magazine. So I'll show you that. Oops, sorry. So it's taken from Nursing in Practice. It's a nursing magazine. So you can go on there and you can have a look. So it was sent to me about a month ago or less, about three weeks ago. But I've been busy and haven't had time. So the headline says, Hertfordshire nurse struck off after impersonating patient for tramadol prescription. So this was written by Catherine Price. So Hertfordshire nurse has been struck off by the NMC, which is the Nursing Midwifery Council, after impersonating a patient to obtain a tramadol prescription from a GP. Blessing, I won't say her full name by the way, Blessing received a police caution in March 2016 for offences of fraud by false representation, possession of an article for use in fraud, and theft, and was convicted on 3 counts of fraud by false representation in 2018 after attempting to fool the GP surgery to obtain a prescription for the painkiller tramadol. So, of course, if you do this, it's illegal. That's number one. It is illegal to impersonate a patient. To impersonate anyone at all, it's illegal. And it's also illegal to try to obtain medication by false pretenses. Obviously, she might be addicted to tramadol because it's quite addicting, or maybe family members has asked her for it, friends have asked her for it, and it might also be a scenario that she's selling the prescription to others. So it says an NMC fit to practice. So students, if you're watching, I speak about this all the time, fit for practice. You need to be fit for practice. And this is why we do our CPDs. This is why we attend classes. And this is why we always make sure that we're up to date with our policies and protocols because we need to be fit for practice. So an NMC Fitness to Practice Committee in December 2018 suspended Blessing for a year as it was not satisfied that she had sufficient insight to understand the severity of her misconduct, convictions, and cautions, all of which it said were inextricably linked to her health. Okay, so if they're saying that she has no insight into the situation, I mean, come on, as a nurse, you must have insight. You must know that if you've done this, that it's illegal to do so. So obviously she's just been stubborn. In my opinion, she is being stubborn because she knows what she's done is not right. How can you not know? Even if you weren't a nurse and you impersonate someone to get medication, you know it's not right. So she, them not being satisfied that she's got enough insight is just a nice way of saying she's really stupid, she stole medication, and she's pretending like she's correct for doing that. So they gave her a caution, a police caution. Of course, if you have a police caution, you can't be on the register. So, it says further, the suspension order was reviewed and extended 3 times to give this nurse time to engage with the NMC proceedings. So the police caution was reviewed 3 times. 3 times, Blessing, come on, man, 3 times. And you haven't learned your lesson? However, a panel last month decided that there had been a lack of engagement with the NMC. So she's done something wrong. The police has cautioned her, and she refused to engage with the Nursing Midwifery Councils. Students, are you watching this? Remember, the Nursing Midwifery Council set the standards for nursing. Without them, we will have no standards. And if we are a profession without standards, that will simply mean that we can do anything we want to do. We can even kill patients if that's what we want to do. So this is why it's important to understand why we are so hard on you when you break the rules. You must always maintain and stay within the rules. So it says, however, a panel last month decided there had been a lack of engagement with the NMC, a lack of understanding and appreciation that is key to safe and effective nursing practice, and considered there to be a real risk of repetition. So, Blessing, you're telling me that you stole medication under false pretenses. The Nursing Midwifery Council is saying they think you didn't, you're not taking it seriously, basically. And now they're saying you might do it again in the future based on what you're saying and how you're behaving. It is said that despite many opportunities by previous panels to develop her insight and address the outstanding concerns, she had failed to do so, that it would no longer be in the public interest to grant her further time. I am gobsmacked, I am shocked, and I don't understand what this person is thinking. So therefore, she's lost her license. She can't practice as a registered nurse anymore, all because she's stubborn and because she doesn't want to see where she's wrong. My advice to you is, if you've done something wrong, never be afraid to stand up and say, I've done something wrong and I'm sorry and this won't happen again. Because it seems like this is all they're asking. Maybe there was an issue there. Maybe there's a health issue and she needed medication and the GP wouldn't give her. And so she did something to get this medication. And it seems as if the NMC appreciated that. The police appreciated that because they suspended her caution. So they appreciated that, and they've decided to give her a chance. It seems as if here that they've sent her in training, and it says that she's failed to have any insight. She doesn't appreciate safety of patients. This is sad. So they will not give her, they've taken her PIN number off her, I'm sure. Let's read on to see what they've done. It may be that the patient, the nurse health has been inhibiting her ability to respond, but the panel was satisfied that she could at least have given some explanation at some point in the last 2 years of what her circumstances were. It said it was not satisfied that a further suspension order would serve any useful purpose. So they've given up on her, basically. So maybe she's not responding to the letters, to the emails. That doesn't make it better. Respond to your letters, respond to your emails. If you're not sure that you can do so, get a solicitor. Get a solicitor if you think you're unable to respond. So I think what they're alluding to here is that she's saying that she was too unwell to respond. But this is serious. This is your livelihood. This is your PIN number that allows you to work as a nurse. So certainly you should try and respond. So it says, as a result, the panel determined it was necessary to prevent this nurse from practicing as a nurse, and that the only sanction that would serve the wider public interest was a striking off order. So she's done this to herself. The NMC, which we all know is not very understanding, has proven to be very, very understanding, I guess because of health issues, but she would not attend the meetings. She would not respond to any of their correspondence, and so they've taken her. The striking order will come into effect the 16th of October, this month, when the 9-month suspension order is due to expire. So she's been taken off the register. She can't work as a nurse, and it seems like she doesn't respect the nursing profession. There's a little note that says, this comes after a care home nurse was struck from the NMC register in August after it was found that she had abused a care home resident, pulling away her Zimmer frame and calling her childish and stupid. What is going on in nursing? Are you all crazy? Have you hit your head? And this is why it's so important. I'm going to talk to my lecturers, my nursing lecturers, and those who teach nurses, the nurses on the wards who sign documentation. There's an article that says nurses are afraid to fail students. Fail them. If they fail, they fail. Bring them to Fitness for Practice, because these are the nurses we get when we do not fail students who need to be failed, because obviously I think this person needed to be failed as a student. And who's pulling a Zimmer frame away from an old person who needs it? They're going to fall over. They've got no love, no compassion, no caring, no insight into bad behavior. And we do have professional practice, and we do have evidence-based practice, and we do have leadership and management. So therefore, they're not paying attention in university, and they're not paying attention when they're being trained on the ward. So my advice to my students, it's really important that you read your NMC code, that you understand your NMC code, that if you have questions, you ask people like myself, and that you ask people on the ward if you have questions as well. It's important that if you think you've done something wrong, that you stand up, you put your hand up, because we've all made mistakes. Put your hand up, say you've made a mistake, engage with people when they're trying to engage with you, okay? So anyway, that's my rant for the day. Thanks for watching, and please remember to like, share, and subscribe. And my students, leave a comment down below. Tell me what you think about this, especially the one who pulled the Zimmer frame away, and and also Blessing, who decide that if you can't get your medication from your GP, you should falsify things to get medication. So tell me what you think about that in the comment section, and I'll be down there answering and chatting back as well. So thanks for watching, and don't forget to like, share, and subscribe.